into what you just said. You mentioned that you became significantly more efficient as a surgical resident, and so it was easier to transition into internal medicine and into emergency medicine after that. And I was curious to hear if you felt like you typically had enough time to counsel patients, because I know you mentioned that you talked to the heart attack patient and you convinced him to stay, and you talked through the research with him. And as an EMT, I feel like I constantly have to counsel and calm down my patients as well. And so I was curious to know if you felt like you typically had adequate time to do that with your patients.
That's another good question. We do have time, very often have time. Sometimes I don't have time. But so it's the variety you get in emergency medicine is really what I love. I love the variety. I think nowadays this diagnosis of ADD is like pretty prevalent. But when I was going in school, I don't think anybody was diagnosed with it. I may have been diagnosed with it if I had been grown up in the past. If I was much younger, because I just it's not that I can't focus on things. It's just that I like variety. I like fast pace. I also like to be intense about things, and I like to be able to communicate my ideas and try to provide empathy and to patient. So it depends. It depends on me and my situation, and sometimes you have time. Sometimes it's very gratifying in that way. Sometimes you're a little frustrated because you're so busy. Maybe you want to talk to a patient for a long time. And the other thing is that if you get really, really good at your job, and you become very efficient, you can, even in a busy department, I can sometimes really take the time. If I'm caught up, I could have 15, 20 patients I'm taking care of, and my notes are up to date, and people are just rolling in one after the other. And I want to take 5 or 10 minutes with this one patient to just talk to them about something, or a family member or whatever. Sometimes I'm able to take that time. If you're not efficient, and there are those out there who have not been able to conquer the efficiency hill that you need to conquer, and then they don't have any. They're always behind the 8 ball, and they're always running behind, and they're staying 2 hours late to finish their notes after their shift. But you have to be efficient. You have to and you have to work on that, because let me tell you something. Being a doctor isn't just all about just the knowledge of taking care of patients. You have to be able to use the electronic medical record to its fullest. Even though I think in this my lack of being able to stop my screen saving, despite that, I am actually pretty good at computers for my age, I think. So I'm very, very good at using the EMR. We have an EMR called Epic. It's excellent. If you can put the time in to learn how to use Epic and use it to its maximum capacity, then you can become much more efficient and see much more patients and have better documentation, more accurate documentation, and not use these massive templates for the same thing for everybody. And it becomes a lot easier to use your time efficiently, and being able to see those patients and spend time with the patients you want to spend time with. And then sometimes, you want to be quick and just, and sometimes patients aren't talking to you, and you don't, and that's okay. And you do what you need to do, get out of there and see the next patient. So it's very variable. That's, I think, what I like about emergency medicine. There's never a day that's the same. Yeah, huge variety.